An interesting question that I always get, whether it's in the office or out of the office in casual conversation, what is the difference between Botox and filler? So I'm going to give that description as well as break up the different types of fillers also that people ask about. So Botox is a compound that blocks the nerve affecting the contraction of a muscle. And so when that nerve wants to move a muscle, it's not able to because Botox blocks that action. So if you have wrinkles in your forehead, I'm going to lift up my forehead and wrinkle it, or frown lines, you put Botox to soften those wrinkles because those wrinkles occur when the muscle contracts, just like on fabric. When you contract, the fabric wrinkles; when you contract, the skin wrinkles. So if we can eliminate that contracture, we can get rid of the wrinkle. It works on many different areas, sometimes differently, but mainly it's used for wrinkles around the 11s, between the eyebrows, the forehead wrinkles, the crow's feet wrinkles, and also because muscles in the neck give you neck bands, if we gently inject those neck bands, they tend to soften and it gets rid of some of the neck bands and neck wrinkles. That's the big use for Botox. Another use for Botox is because it blocks that nerve innervation to the receiving organ, whether it's a muscle or a sweat gland. It can also decrease sweating in the armpits. So if you inject Botox into the armpits, it's relatively painless, very quick, incredibly effective. You will not sweat anymore in your armpits or your hands or your feet. So that's another major category for Botox injections. I'll give a third one, which is a minor category for Botox injections, but can be very helpful for people who have migraines in and around the forehead and temple area. You can use Botox to minimize the migraines that happen from the contraction of the vessels in and around the forehead and temple region. And I'm going to give you one more that we use Botox for today, and that is for muscle spasm in and around the neck. We have women coming in who have tension headaches because their trapezius muscle is too strong, and in so doing we have found it thins the neck. So a new treatment that we use for Botox is for muscle spasm, sweating, and for migraine or tension headaches. That's Botox. Filler there are a myriad of fillers, from hyaluronic acids to your own fat, that we can inject. Sculptra is another one that can give more volume to the face, because as we age, the volume of fat changes in parts of our body. You'll see, as I see, losing fat in the face, gaining fat in the body. And you're thinking, how does that happen? It's just a normal change with aging. So what can we do to give you back that youthful fullness? And we don't want to overdo it. A lot of people see it way overdone. Those are the pumpkin heads and the balloon heads that we all talk about, the lips that look like sausages. That's not what we do. It's subtly done to replace the volume in specific areas in and around the face. The temples, the cheeks, the nasolabial folds, the marionette lines, in and around the lips, airbrushing of the fine wrinkles around the lips, fine necklines. We can replace the volume with fillers, which are HA fillers, Juvederm, Voluma, Velour. We can use Sculptra, which increases the collagen production. It's done over several treatments, but there are a lot of different ways to fill the volume back that you lose with time and aging. And then we can also take a little bit of your own fat and process it and layer it on to the areas that are deficient. To answer the big question, the difference between Botox and fillers, Botox is a compound that decreases the muscle contracture, and fillers replaces the volume to the face.